occasion of World Arthritis Day, today our topic for discussion is how can we prevent arthritis? And for our discussion, we have with us Dr. J Reddy, Senior Consultant Orthopedic Surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. J Reddy is graduated from Osmania Medical College. He did his MBBS from Osmania Medical College and MS from Chandigarh and spent 14 years in UK. Dr. J Reddy is having an experience of over 34 years. He has got a passion for teaching and training many surgeons. He has written many publications in India and international journals. He has treated many of the sport legends, to name few: Sania Mirza and Sir Richard Hurley. Right now, he is the Chief Joint Replacement Surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Welcome, Doctor, to our Facebook Live session.
Namaste.
So, starting with our questions. So, Doctor, what do you feel about World Arthritis Day?
Yeah, I think today, 12th October, we celebrate World Arthritis Day. This is to bring awareness among the general population and in the society. It's understanding the symptoms, treatment and prevention. As we know, if the general people know more about the disease and the treatment, the standard of treatment goes up. It is proven in developed countries. So the main intention of celebrating World Arthritis Day is to bring awareness among general population about arthritis.
So, Doctor, usually what is knee arthritis?
Yeah. Knee arthritis can be due to various reasons. Most common is osteoarthritis, where there is wear and tear of the knee joint and which will lead to pain, swelling and disability in walking. We don't know exact cause, but the repair mechanism is lost in some people, which will lead to damage to the surface and arthritis. Other causes are rheumatoid arthritis and many other seropositive arthritis are there, but majority of the population is suffering from osteoarthritis of the knee after the age of maybe nowadays younger 45 and above.
So, Doctor, what usually causes knee arthritis?
The primary osteoarthritis, the exact cause is not known, but we know the mechanism where day-to-day activities there is damage to the articular cartilage which is repaired in normal people. But people who are prone for osteoarthritis, this repair mechanism is lost. So it goes on and the cartilage is damaged, lead to degenerative changes in arthritis. That's the primary arthritis. And more common secondary arthritis, where we know the cause, which can be preventable. Like any accident, there may be injury to the cartilage which is not diagnosed by x-rays, or any infection or any deformity during childhood which will lead to like bow legs, knock knees, where abnormal forces are put in the knee joint which will lead to arthritis. And any other generalized diseases like rheumatoid arthritis also causes degenerative arthritis in the knee.
So, Doctor, how can we prevent knee arthritis?
Yeah. So, primary osteoarthritis probably difficult to prevent, but we can slow down the process if we diagnose early. There are 4 stages of arthritis, stage 1 to 4. If we can diagnose in stage 1, 2, probably there are various means of slowing down the process of degeneration and arthritis. Most of these people, osteoarthritis, can be treated non-operatively. So stage 1, 2, probably simple lifestyle modification, weight reduction, dietary advice, simple analgesics, physiotherapy and making muscles strong, bones strong, will slow down the osteoarthritis. Whereas in case of secondary osteoarthritis, most common cause of secondary osteoarthritis, damage to the articular cartilage during young age. Most of the time it happens in sports, but in India very often happens in two-wheeler accidents, where during accident the leg is caught in the bike and twisting of the knee injury, which will damage the knee. Initially they'll have pain, swelling, but most of them get x-rays, and x-rays will be normal because there is no problem with the bone. If you get an MRI scan at this stage and diagnose cartilage lesion, we can prevent arthritis. We can repair this cartilage by growing the cartilage. We can take their cartilage cells, send them to the lab and grow their cartilage cells and implant into the knee joint, which will grow back their normal cartilage in majority of the patients, which will prevent osteoarthritis. And people who are born with deformities, if you correct the deformities of the legs at earlier stage by doing corrective osteotomies, it will also prevent osteoarthritis. In case of rheumatoid arthritis, if we diagnose early and take disease modifying drugs, nowadays so much advancement in the medical management of rheumatoid arthritis, so you can prevent severe arthritis of the knee joint. Similarly, any secondary cause can be treated which will prevent severe osteoarthritis.
So doctor, are there any particular ways by which we can diagnose arthritis early?
Yes, I think the ways is most of the time what happens is once arthritis sets in, we will have pain, especially in walking initially, going up and down stairs, sitting on the floor, because going up and down stairs, sitting on the floor and getting up puts about 10 times of the body weight on the knee joint. So even minor damage will be painful. And most of the time symptoms, then early diagnosis, probably X-ray may be normal. If you get an MRI scan, we can do early diagnosis and probably slow down primary osteoarthritis. In case of cartilage damage, we can repair by growing cells back into the cartilage.
So doctor, what is the role of stem cell therapy?
Yes, I think that's there's so much of advances recently. Now we are dealing with third generation cell therapy, stem cell therapy, where we take the sample of the cartilage of the knee joint where we need a repair of the same patient, send it to the lab, and we grow chondroblasts which have the ability to grow. It will take about 6 weeks to have enough number of these chondroblast cells. And the second operation, we open up or do endoscopic surgery, and the defect of the cartilage we implant with a fibrin glue. We can go up to 16 square centimeters of the damage, and it will take about probably 6 months, maybe up to 2 years. In majority of the cases, the cartilage within the knee joint is repaired by these chondroblasts, and this will prevent secondary osteoarthritis or osteoarthritis.
So doctor, what is AVN, necrosis of the hip?
Yeah, that's, I think, avascular necrosis of the femoral head is one of the leading causes of arthritis of the hip following COVID. Before COVID times, necrosis of the femoral head was usually caused by alcohol, steroids, and some of them are idiopathic. But following COVID in 2021, the incidence has gone up significantly. For example, in the past we used to see maybe 1 or 2 in a month of necrosis of the femoral head, but we see about 4 to 5 cases every day. And this is because of the COVID itself and combination of COVID infection with steroid treatment, which leads to stoppage of the blood supply to the femoral head, death of the femoral head, leading to osteoarthritis of the hip joint.
So doctor, usually what are the causes of the necrosis?
Yeah, I just mentioned about causes. The leading cause presently is long-term effect of COVID, and other causes are alcohol, steroids, sometimes idiopathic, rheumatoids, and some blood diseases can cause avascular necrosis.
So doctor, does necrosis leads to arthritis?
Yes, what happens is once blood supply is lost to the head of the femur in the hip joint, it will become weak and it will collapse and it becomes irregular in shape, which will lead to arthritis of the hip joint. Again, this is in 4 stages. If we diagnose early stages, stage 1, 2, probably we can prevent it. But if passes to stage 3 and 4, lead to arthritis, severe disability, stiffness, pain, difficulty in walking, which will need hip replacement surgery.
So doctor, how can we prevent progressing arthritis and the role of stem therapy?
Yeah, I think recently again in the hip necrosis treatment, we are dealing with the 3rd generation cell therapy. What we do is we collect the bone marrow, send it to the lab, grow stem cells, those are osteoblasts, and what we do with a small operation under X-ray control, we take the dead bone out of the hip joint from the femoral head and replace that with fresh stem cells, that's osteoblasts, fill it up, and they will stay there, repair the damaged part and grow the new bone. Probably it will take about 18 months to 2 years to complete the process. But if we diagnose early, if we treat stage 1, stage 2, probably stage 2 to 3, that is 2B, there is about 80% success rate. So it is very, very important. People who had COVID, people on steroid treatment, and people previous history of trauma, if their hip is dislocated, if they complain of pain in the hip pain generally happens in the groin region as well as in the thigh region. So those people, majority are young people, complaining of pain in the hip joint, that is the groin or the thigh, and especially people taking alcohol as well, they should see the doctor. And most of the time, the X-ray may be normal in initial stages. So you should get an MRI scan, then we will be able to diagnose early. If it is stage 1, 2, we can prevent arthritis by treating with the stem cells.
So doctor, are there any particular dietary and exercises for arthritis?
Yes, I think the best way of prevention of arthritis or progression of arthritis is exercise. As I said, when we are walking on a plain ground, about 5 to 6 times of body weight passes through the knee joint as well as hip joint. When you are going up and down stairs, it will go up to 8 to 10 times. When we sit on the floor and get up, especially Indian toilets, the weight will be up to 15 times. So this weight, if muscles are strong, what happens is 50% of the weight passes through the muscle, 50% passes through the knee joint. So joints are protected. As you might have seen, when sports person falls down, he doesn't get injuries because by reflex activity, the muscles will contract and they protect the bones and joints. If unfit person falls, it will damage the joint or break the bones. So it's important to keep your muscles as well as bones strong to protect your joints so that they take all the loads when you're doing day-to-day activities. So the exercise is the best way. Load-bearing exercises like cross trainer, swimming, maybe a little bit of weights for upper body would improve strength of the muscles as well as the bones, which will help your joints. Diet is also very, very important because if you nowadays, I think we are quite used to junk food, which is not good for the bones, joints and muscles. You should eat a healthy diet, mainly fresh fruits, vegetables and high protein diet, dry fruits, and reduce the amount of sugars you take, especially carbohydrates and fats, and reduce the weight, which will also impact on your dietary intake, and good amount of vitamins, minerals, and probably glass of milk every day will supplement most of your vitamins and minerals.
So coming towards our audience questions, so doctor, does being overweight affect arthritis?
Yes, I think that's a very common question asked. Overweight itself will not lead to arthritis, but those people who have early arthritis or established arthritis, overweight will increase their progression as well as their amount of pain symptoms, the severity. So if you early stages, if you lose your weight, your symptoms will go away. Probably the progression of arthritis also will slow down. So it's important to lose weight, those who are overweight.
So doctor, can cracking knuckles cause arthritis?
Trekking, I think what happens is, if you are unfit and do trekking, it will cause. But if you're a fit person, trekking will not cause arthritis. It has been known that if your muscles are weak, if you do too much of walking up and down, especially uphill, downhill, it might affect the joints. But if you are fit, muscles are strong, it will not lead to arthritis.
So are there any particular foods that triggers arthritis?
I think scientifically there is no diet which will trigger, but diets which will increase the weight should be avoided. But there is no direct relationship between the diet and arthritis apart from weight.
So are there any early warning signs of arthritis?
Yes, I think what happens is, if there is a history in the family that their parents, grandparents had arthritis, probably had knee replacements or hip replacement for arthritis, you should be careful. So there's likely, there's no direct gene, but it runs in families. And arthritis first symptom is pain. Pain especially when you're walking long distance, when you're going up and down stairs, or when you're sitting on the floor and getting up. These are the early stages of arthritis where you get the pain. And probably sometimes you get swelling followed by pain. Those are the signs you must recognize and must see a doctor.
So how fast does arthritis spread?
Yes, a progression of arthritis is not really very predictable. What happens majority of the time, it's a slow progression. But people with high risk, especially people with obesity, muscle weakness, or people with a family history, the progression can be rapid. Over a period of few months or years, it can get very severe. But most of the time, osteoarthritis is a slow progressive disease.
So what are the most effective treatments that can be given to an arthritis patient?
Yes, I think most effective treatment, prevention as well as treatment of arthritis is, you must keep your joints healthy. To keep your joints healthy, your bones must be strong and your muscles must be strong. So regular exercise. The common notion is, people say, I've got arthritis of the knee or hip, I've gone to see a doctor, he said take rest completely, not to do any physical activity. That's very bad advice. Those people with arthritis, they must do regular exercise, because the nutrition of the joint depends upon your activity. If you don't move your joints, the joints will not get nutrition. So even it is painful, you must walk, people with early arthritis, even with arthritis. But you should avoid some of the activities like climbing stairs or sitting on the floor, and whichever most painful you should stop. But regular exercise, swimming, cycling, walking is very important for people with arthritis.
So doctor, does weather affect arthritis?
Yes, it does to some extent, not arthritis but symptoms. What happens is, during cold weather, or if AC is very low, what happens is our pain threshold will go down. So even you might have noticed during winter times, little injury, if you hit something, will be very painful, which doesn't happen in summer. So during cold weather, what happens is arthritis symptoms get worse. So those people with rheumatoid arthritis or osteoarthritis should have a good clothing, warm clothing, socks, maybe gloves if they go out, and it's more important in cold countries. And they should have a good cover during sleep, blanket, maybe good blanket, so that symptoms are less. They should keep their body warm.
So usually why do joints make popping and cracking noises?
Yes, this is also common symptom. Most of the joints are make cracking noise. And what happens is, most of this cracking noise doesn't happen within the joint. It's because of the ligaments and muscles around. As long as these cracking noise are not painful, not to worry. Little bit of exercise, physiotherapy, they will go away. If this noise is painful, then that's a sign of arthritis. You must see a doctor.
So are there any new research in arthritis?
Yes, I think what happens is, we discussed it in the beginning, we do not know why arthritis happens, why the breakdown of repair mechanism. There's a lot of research is going on, and molecular therapy, what happens is cell therapy for osteoarthritis itself. Nowadays we give a lot of PRP injection, platelet rich plasma, which will help in repairing early osteoarthritis. We also give hyaluronic acid injections in stage 2-3, which will help because the synovial fluid will improve. And also there are so much of research is going on to get a proper medicine, maybe in the form of cell therapy, to prevent arthritis and slow down progression of arthritis, even treat arthritis.
So coming towards our last question, doctor, could you please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills, Hyderabad?
Yeah, we have state-of-art facilities for all stages of arthritis. If we take, for example, knee, we have to diagnosis, we have state of MRI scan where we can know the thickness of the articular cartilage. So those who are prone for osteoarthritis, we can diagnose them, and we have the facility to do the stem cell therapy, that's chondroblast therapy through a company Regrow. We have the state-of-art facility for joint replacement surgery. As I said, only 10% of the people need joint replacement, total knee replacement, as well as partial knee replacement. We have robotic facility, excellent state-of-art robotic, latest robotic surgery facilities there. As far as hip is concerned, we have state-of-art facility for hip replacements. We can do ceramic hip, ceramic and ceramic with robotic help of robotics. And we have facility to prevent arthritis if you diagnose avascular necrosis, necrosis of femoral head in early stages. We are the center, pioneer center to treat stem cell therapy for avascular necrosis. For the last 5 years, we have done more than 300 cases with about 80% success rate. And in South India, we are #1 center for this facility. So we have excellent results of following stem cell therapy, especially Regrow.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. J Reddy and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Namaste.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.